This GBVIMS video short is an overview of the evaluation from 2014. The GBVIMS was developed so that service providers can collect and share data safely and ethically. The Interagency Steering Committee, comprised of representatives from UNFPA, UNHCR, UNICEF, International Rescue Committee, and now International Medical Corps, have stewarded the development and rollout of the GBVIMS in 30 conflict or natural disaster-affected countries. Quality data about GBV incidents and services is an important element of the approach to GBV programming. Organizations use this data to improve programming for survivors through better targeting of services, advocacy, and fundraising. With the GBVIMS aiding in this effort, 5 years after the introduction of the system, the Interagency Steering Committee decided to carry out an evaluation. International Solutions Group carried out the evaluation. The methods for data collection included global and country-level document review, key informant interviews and focus group discussions with 193 people, direct observation at points of service provision in Dadaab, the DRC, and Colombia, a review of tools and reports used in those case study countries, and a web-based survey administered to former participants of 2 global GBVIMS trainings. Findings from the evaluation indicated that after 5 years of implementation, the GBVIMS had contributed to safe and ethical collection, handling, analysis, and sharing of GBV data. Overall, this led to enhanced services for survivors, better targeted programming, and improved mobilization of funding. Specifically, some findings revealed the GBVIMS enhanced coordination between GBV actors in interagency contexts, not only through negotiating the information sharing protocol, but also through engaging in the process of analysis of GBV data. Improved regional and country-level expertise, particularly within UN country offices, INGO, and NGO offices. There's also a continued need to build country-level capacity and ownership, and to build capacity for the GBVIMS and emergency preparedness. Further, findings showed engagement with governments has taken the form of advocacy and support for the improvement of safety and ethical aspects of GBV data collection systems, which was rated positively. And finally, it strengthened analysis as service providers were analyzing and using GBV data for donor reports and fundraising to better target their programs and improve both prevention and response aspects of programming, and to identify gaps in service provision and advocate for services. In addition to the positive outcomes of GBVIMS implementation, there were also some challenges identified. Evaluators found that tools have improved service provider practices around GBV data management, and that there were sometimes different understandings around how the tools were intended to be used. Based on this finding, the evaluators added that the GBVIMS documents and guides must be complemented by face-to-face technical support and training, on-site initial or refresher training, mentoring, and monitoring by the global team are essential to ensure correct use of the tools. Along those lines, the evaluators found that the GBVIMS rollout process and technical support mechanisms have been critical for successful implementations. Some elements of successful implementations include strong technical support, country-level ownership, a phased approach where lessons can be learned, strong and dedicated coordinators, and existing interagency coordination. Second, the rollout criteria, developed by the steering committee, and adherence to those criteria were essential for quality and sustainable implementation. And finally, the range of support materials developed by the GBVIMS technical team are key resources for country-level staff in senior management positions and coordination or focal point roles. They're also consistently referred to and used to address technical questions throughout the planning, rollout, and maintenance phases. The global management structure of the steering committee and technical team was also deemed highly effective in supporting rollouts. By this structure, we mean the technical team made up of representatives from UNICEF, the surge team members, UNFPA, UNHCR, and IRC, all governed by the steering committee with representatives from those same agencies and organizations. Specific findings included that there is a clear structure and good level of collaboration and coordination, and an ability to respond to identified needs. However, the GBVIMS system as a whole has weak M&E or monitoring and evaluation mechanisms, and there's a lack of institutional funding for the system. There were 4 core recommendations from the evaluation. First, to increase linkages between the GBV-IMS and case management. Second, to develop a monitoring and evaluation framework to guide planning and monitoring. Third, to better exploit GBV-IMS support materials by further dissemination. And fourth, to consider other platforms for data collection and storage, in particular to accommodate settings with high technological capacity. Overall, the system has been highly relevant and effective as a GBV data collection system, offering a safe and ethical solution for collection, management, and sharing. It's not just a system for managing information. It's a fundamental component to enhancing comprehensive GBV programming in humanitarian crises. Recognizing those recommendations and ongoing technical and funding support is required to maintain momentum. The steering committee has committed to a few key things. First, to continue our commitment to further implement and maintain the system. Next, we hired an M&E officer to develop standardized M&E tools for the technical team to track the outcomes of our work for continued refinement and improvement. Next, as you'll notice right now, we started producing video shorts and a podcast to accommodate different learning platforms to aim for convenience and ease of continued learning. Next, we'd also been highly engaged in the process to develop the next iteration of the GBV-IMS database, called Primero, or GBV-IMS Plus, which was piloted in 2015 and continues to be developed with further global rollout coming soon. This represents a system that allows us to take advantage of recent technological advances. Next, we've committed to engaging further with the case management pillar and ensuring those linkages through shifting a surge team member focus on case management coaching and investing in the development of the interagency case management guidelines, which are available now. Finally, as we close out, this year, 2017, we're celebrating something special. 10 years of GBV-IMS implementation. From 2007 to 2017, 30 countries, and the list continues to grow. So be on the lookout for a report on 10 years of implementation coming later this year. Thanks for watching. As always, be responsible with your data and learn more at gbvims.com.